Now, the bleeding per se has to do with the level of penetration. There are some people who have even lost their virginity to some forms of exercise, things are just like in the gym, riding of the static bicycle and all those kind of things. Things like that have caused people to lose their virginity, And of course, some hospital procedures, like I was telling you.
Now we'll begin today's conversation taking our quote from Michael Bassey Johnson. He is a progressive author, a poet, a philosopher, and a nature enthusiast. He once said, "When a child preaches or reaches puberty, parents become so curious about their sex lives and their whereabouts, put them behind bars to their own detriment. When such a child breaks free, don't be surprised to see him or her in porn movies." Okay, I would not say anything. Let's just take our second quote, and this one is from Chimamanda Ngozi Adichie. She is a feminist Nigerian writer whose work include novels, short stories, and non-fiction. She once said, "Talk to her about sex and start early. It will probably be a bit awkward, but it is necessary." Absolutely spot on, if you agree. Warm greetings and welcome to The Conversation. We're reaching you from Kaftan's television studio here in the nation's capital, Abuja. I am Annabelle Oji. Now, sex education is the provision of knowledge about body development, sex, sexuality, and relationship, as well as skill development to assist young people in communicating about sex and making educated decisions about their sexual health. Sex education should take place across a student's grade levels, with materials tailored to the student's developmental stage and cultural context. It should include puberty and reproduction, abstinence, contraception and condoms, relationship, sexual assault, prevention, body image, gender identity, and sexual orientation, among other topics. Now, comprehensive sexual education is critical in preparing young people for a safe, successful, and satisfying life in a world where HIV and AIDS, sexually transmitted infections, that's STIs, unwanted pregnancies, gender-based violence, and gender inequality continue to pose significant threats to their well-being. Sex education also provides people with the knowledge, skill, and motivation that they need to make informed decisions about their sex and sexuality. Many young people enter adulthood with contradicting negative and confusing messages about sexuality, which are sometimes worsened by adults' embarrassment and silence, including parents, guardians, and instructors. Now, on the show today, we will be focusing on body safety education and violation of the girls' rights and vagina and hymen, and as well, we'll also get to know when it is the right time, or when is it the right time to educate our kids on sex and sexuality education. Ooh, quite different, you say? Now you're gonna love this, so don't move a muscle. We will be right back. Welcome back. If you just joined us, this is The Conversation. We are reaching you from Kaftan's television studio here in the nation's capital, Abuja. Now, to help us commemorate International Day of Women 2022, we have a doctor of females. He is Dr. Audu Onuche. He is a consultant gynecologist and obstetrician. You're welcome to the show.
Thank you for having me. Good afternoon. All
right, great to have you. Okay, so today we will be advocating on girls and women, sexuality, and why you should leave her hymen alone. Okay, so before we get on to understand about why we need to advocate for women's or children's sexuality, let's start by getting your thought. Let's understand the anatomy of a girl or woman's vagina. What is a hymen?
Okay, the female genitalia is divided into two parts: the external female genitalia and the internal one. The external one is the one that you see basically when the woman is undressed and is exposed. And the internal ones are the ones that you require specific instruments to be able to see, like a speculum, that's beginning from the cervix, the uterus, and of course, other surgical instruments like a hysteroscopy or laparoscopy to see the ovaries, the tubes, and all of that. So now coming to the external female genitalia, which is where you have the hymen, the labia majora, the vulva, vagina, and all that. The hymen is a thin membrane that covers the entrance into the vagina. So it's a way of knowing that a woman is a virgin, because if the hymen is intact. And of course, we've had cases in hospital whereby people have accused someone of raping them or sexually violating a particular person. And one of the ways, of knowing if the place has been tampered with in somebody who is a virgin, I've never had sexual intercourse before, is that the hymen is intact.
Okay.
And even sometimes in medical procedures, you want to do certain things, but because the hymen is intact, you have to defer those procedures so that, it can
What defines an intact hymen?
Okay, well, that brings us to different kinds of hymen. There are different classifications of hymen. Now, there are even some cases whereby the hymen, because normally some hymens like the cribiform hymen, you have some small perforation. But like I said, it's like a thin membrane. Membrane is like, let's say, like this thin cloth kind of that is, covering the opening of the vaginal introitus. So if you have some conditions where you have an imperforate hymen, normally you should have like a small opening, very small. But there are cases of pathologies whereby it's imperforate, so those ones have to be opened surgically. But there are some that have some small openings.
Is that from birth?
Yes. Yes. Yeah, there are some that have some small openings, and there are some that are open and maybe may have a thin lining in between, So those are different types, but medical personnel are trained to be able to identify and know if there's been any manipulation or violation, in this case. Okay,
so now I hear you talk about a virgin. You should be able to know if her hymen is intact or not.
Yes.
But then in some cases during sexual intercourse or maybe rape and all of that, some people come out to say that they did not bleed during sexual intercourse. So some people say they bled during sexual intercourse, and a lot of people have already seen that as she's a virgin or she's not a virgin. Like you see in the movies where some people, a particular person wants to marry a lady or girl, and then they take her away when the hubby sleeps with the girl and then find out that she doesn't bleed. He believes that she is not a virgin, and then he packs her back home. So is that what exactly, why do you have some people bleeding at the time and then some people are not?
Okay, well, all of these have to do with the anatomy and certain specificities in different individuals and all that. Now, the bleeding per se has to do with the level of penetration. There are some people who have even lost their virginity to some forms of exercise, things that just like in the gym, the riding of the static bicycle and all those kind of things. Things like that have caused people to lose their virginity, And of course, some hospital procedures, like I was telling you, a common condition for which women come to the hospital is for fibroids. So I've had patients who are virgins, even in their 20s, 30s, and all that, And when we want to do this particular procedure, there are certain investigations that you need to do before you get to do the operation. One, you want to check that the woman's fallopian tubes are not blocked. And the way of doing that is by doing a HSG, which is a radiological investigation, whereby a contrast medium is put and it shows, when it spills, it shows that the tubes are, patent, that means they're not blocked. But for you to do this, you need to put a speculum in. And if you want to introduce a speculum into a woman's vagina and the hymen is intact, then you rupture it by, so in these kind of cases, which are things we'll talk about further in the discussion about women's rights and all that, sexual rights, you need to give the woman an informed consent about this. So like that kind of case, I've had a patient like that, and I had to explain to her that, okay, because of this surgery that we're going to do, we want to be sure that your tubes are intact, but we need to do this. But this that we're going to do would affect your virginity. That is, the speculum will definitely rupture the hymen and all that. So in that case, we had to waive that for her, but with the explanation that we would not know if her tubes were patent or not. And well, that did not seem to be her problem. So she went ahead to say, okay, you can waive that for me so that we don't, because a lot of women, especially those who have been able to keep it till, you know, certain age or at least before marriage, it's something they value, they treasure so much because of the way society sees it. So they'll do everything to preserve, you know, their virginity. But there are so many ways to which people lose their virginity without necessarily being sexual intercourse. And also people are going to find ways of not necessarily the hymen, but vaginal tightening, which I read recently of some substances like the alum they use to purify water. People use that to, you know, kind of deceive. And there is even some surgical procedure in which doctors could virtually reconstruct a hymen, you know, to give some women that sense that, okay, they're virgins, because women are really scared in traditions whereby they will be disgraced if, you know, there's some who say they must show the bed sheets after the affair, exactly, and stuff like that. Some of them sound absurd though, but they are realities even in modern day world.
Okay, so now that particular mentality of using alum and all of that, does that thing even work? Well,
because alum has got some properties.
Okay.
You know, there are even some that as doctors discovered recently. There are these local people that do manicure and pedicure and all that. And the particular one was doing like pedicure for somebody, and in the process, he injured the person. And there was some bleeding. And the local person does not even have any medical training or anything, just brought a piece of alum and put it aside there. And, you know, immediately the blood stopped. I was like, oh, well, but if we could sterilize this alum, maybe we could now introduce it to medical practice as what you can use to, you know. But, you know, at that level, some people have some training or at least basic knowledge that this thing, so definitely must contain some property that could maybe constrict, you know, blood vessels and, you know, membranes around to tighten up. Because definitely in my own way of trying to understand it, putting the alum there that stopped the bleeding probably got the blood vessel there to constrict. By constrict, I mean tighten, you know, and it stopped. So maybe similar property is available for.
Is that healthy?
You know, like that's why I said that if I were going to extrapolate that into medical practice, first I want to be sure that that thing is sterile. You know, it's been disinfected and all that before, because this man brought it out from his pocket or wherever and put it there to stop the bleeding. So even though it helped to stop the bleeding, but what about infection and all that could, you know? So I think just a little polishing of that particular method. Well, but I mean, I don't think that it should be something that people should now begin to want to say, oh, because I want to give an impression. Okay, if one had lost it, okay, yeah, so what? I mean, we shouldn't be playing God. We shouldn't be playing God to be the one to determine who is more righteous or more, you know, qualified and all that to get married.
Okay, so now let's talk about checking the girl child's hymen, especially regularly during every bath or wash time. And then you see some people, some parents, because they want to check if the daughter is still intact, or probably not, no one has gone there. So you see some people, you just hear of some absurd things that they put in, very insane things. Either they use egg or they use oranges or lemon to insert into the girl child's hymen to be sure that she's still intact. Is that hygienic?
No, definitely not, because, I mean, if a woman is supposed to be examined and all that, it should be done by someone who is trained to do that, because in the process you could create some lacerations, and of course, I bet you that this is not sterilized, so you could introduce some infection to that area. And create a problem. And even in the process of forcing, okay, I mean, an egg, if the egg cracks and the shell and all that, one of those could actually go there and really want to lacerate and create a problem. So I think rather than doing that to check if this thing, put more effort into the upbringing of the child, so that, you know, make them understand why they should defer sexual intercourse till marriage. I think that works better than trying to go in there to check and, you know, even psychologically to affect any child. Or
I was going to come to that. How does this even affect her psychologically?
Every time you want to take a bath, parents are coming to check and check. I think, man, let's put more effort into educating them properly as children, like catching them young and bringing them well, uprightly, so that they want to make informed decisions, you know, and delay this.
And you talk about checking them and educating them. Now, for parents, because these things still happen up till tomorrow.
No, definitely.
So for parents who are indulging this kind of things, is it actually, is it right? Is there any kind of law backing this saying that you should not do it? Because if you go and meet some parent, they'll tell you, I gave birth to my daughter. You cannot tell me how to train my own daughter. So what is wrong in it, and how do we begin to educate this kind of parents or guardians that this act is all shades of wrong?
Okay, well, like you rightly said, because of course, depending on where you find yourself geographically and all that, there are certain things that, you know, but in other climes, more maybe developed climes and all that, children can take the phone and call the cops or the police on their parents. And, you know, but definitely those kind of things don't work here in our society. Someone said, if you call a typical policeman for your parents, but if he actually comes there, he will even join the parents in beating the child and saying, oh, spoiled child and this and all that, you know. So those are things we find it. So unfortunately, even though we have like things for Child's Act rights and the Ministry of Women Affairs and all the places that are supposed to look at rights of, you know, women and children and all that, but these things still happen, and, you know, people have this state of not wanting to, you know, meddle into things that has to do with children and parents. So the advocacy still has to be on parents to understand the reason why. And of course, okay, like yesterday I was seeing a patient who came in the company of her parents, and I think she's having what you call amenorrhea. That means she had not seen her menses for quite some time.
Okay.
And my concern was, she came with her father and mother, and the father was just sitting in front of her like this. So at the point I said to the mom, and I said to the girl, okay, you're my patient actually. Are you comfortable? Like both parents here and all. And I told the mom, and I had to explain to her, because the thing is that there are sometimes people could, you know, open up to the doctor and say certain things, but they're afraid of their parents knowing, and I may need some information to get to a diagnosis. I've had a patient who had an ectopic pregnancy, and she needed surgery, which was done eventually. And she came back pleading with all the doctors and hospital staff that, please, under no circumstance should her parents be told what happened and all that. That she had done research. So you see, they used the internet to find out that the kind of surgical incision we make on the abdomen for ectopic pregnancy is also the type you can use for an ovarian cyst. So she'd rather tell her parents that she had an ovarian cyst than that she had an ectopic pregnancy, because of course she must have had sex before she got pregnant. So there's so much phobia, fear of young ladies, of their parents, that they prefer to hide certain vital information because they're afraid, you know. But I think rather than fear, if they are well brought up and parents talk to them freely about these things, expose them early enough to know and bring them up properly, there will not be that fear, and rather they'll be able to be free to talk to their parents when certain things are happening and get proper guidance. All
right, so I hear you talk about you should early education, educate your child. That's far better. So at what age is early if you have to talk to your children? Because we've seen some parents, they don't even call the names of their of this sexuality. They don't call a spade a spade. They just tell it is either your pee or it is your wee wee. They don't call it what it is. What it is,
exactly. Yeah, well, fortunately, in our own climb, it is that way. It will take a lot, you know, to change that. But of course, people need to start, you know. So, of course, the home is the first school of a child. So the parents must first start by talking to them about it, you know, because we do get cases. I've had a case whereby a parent has brought a child because they thought that probably in school, maybe the teacher or somebody had, you know, tampered with the genitals of the child. When we saw it initially, it seemed to be like that.
Okay.
But when we examined and had to even call several specialists to come and look, you know, the child had a condition in urology, which is called caruncle, urethral caruncle. But it's so close to, you know, because the urethra, where they urinate from, in the female, is just within the vagina area and all that. So it was like, you know, reddish in color, looking inflamed and all that, you know, had like what we call erythema. So it was looking like something that had been tampered with, but actually it was an inflammation, probably infection that she had there.
Not all situations
exactly,
means it has been tampered.
Yes.
Okay.
So, you know, I mean, the young doctors, by seeing it, probably would like to, oh, something happened here. Close down the school, call child support services, and, you know. took an experienced, senior colleague who came and looked at it. Oh, no, this is what we have here. Then, of course, with the internet, we started Googling and started seeing that, actually, there's a condition like this that, So, now, to say a particular age bracket, I wouldn't say, but I think when the children are able to understand certain things, because believe you me, these children sometimes know far more than we think they know.
Exactly.
They are in a generation whereby they can check up anything on the internet and understand so many things. I've seen situations whereby parents that have devices like smartphones, tablets, and stuff like that. And maybe they'll call their children and say, how can I do this or do that or send this? So the children are even, a bit more advanced now than older generations.
They just consume a lot of things.
Exactly. Now, small children now do TikTok, do YouTube, they have their own channel. Some of them will falsify their age to be able to, get access. They do all these things and they're exposed to a lot. So I remember when in our own days, when there was contemplation on whether they should introduce sexual education to the curriculum and all that. And we were excited because we wanted to really know the things that were seen as taboo or hidden from us and all that. People wanted to know. Of course, we got to know a lot when we grew up and all that. I don't know if that has scaled through, the current curriculum, I doubt. But in other climes, these things are done. I remember when I went to medical school abroad, and while we were about to start medical school, they played a video for us of young couples that were about to, not only couple, boyfriend and girlfriend that way, start medical school. And eventually, of course, they had sexual intercourse and the girl got pregnant. It affected her studies. She had to lose a year. Then during the whole process of labor and childbirth, but the white people that gave us that, video to watch another time, they wanted to send a message to us.
Okay.
And a lot of the girls, when they watched a woman deliver, started crying and they sent a message to we must keep ourselves because we'll lose 1 year of school. And this is all what people really go through. So sometimes making people see the reality of these things when they're able to understand. Of course, there should be a limit because sensitive information you're passing through to them. You want to make them see the other side of it and why they should not, go into this thing before time. I think having that open conversation with them and not necessarily making them be afraid, but let them be free to understand.
But how do you get to make your children their safe haven? Because like you already said, when we're growing up, if you tell your mom or your dad that I'm crushing on a guy, you just know the slap that will come to you immediately. So how do you make them comfortable to tell you a lot of things, especially when somebody make advances at them or something different?
Okay, the thing is this: the parents from early stage, you have to make your children know that apart from you are their parent, you are their friend. That friendly approach. It's not so easy because the natural instinct of the African parent is the child is not doing well, beat up the child and all that. So a lot of people are afraid. Try to make them know that they're your friend and they should be free to talk to you, whatever is going on in their lives, that they're listening ear. Sometimes people aren't talking too much. Listen to them, know their challenges, make them know that you've been through similar situations and these are the best way to go about it. It's not a one-day thing. It starts from day one, how, you inculcate stuff into the child and all that. It's not the easiest of things, but parents are the ones who initially start it. Then, of course, in school also, their teachers, go a long way to impart so much knowledge to them and all of that. But the bulk of the assignment, because nowadays parents now throw all this to the teachers and the school. But, apart from teachers in school, they also have friends who are exposed to all manner of things. So they're the ones that will positively impact, the ones that will negatively impact.
And then in school, a lot of children, they're always very intent listening. They bring all of their 4 ears when you want to talk about reproductive or education. Is it when you're talking about reproductive sexual education and reproductive organs, and when they see the drawing, everything, that's when all of their ears are just jumped out.
No, that is normal. Even when we were in school then, anytime they're teaching reproduction in biology, that's the topic that everybody pays most attention to and all of that, so that's quite normal.
All right, so even as we begin to round up, as today is International Day commemorating International Day of Women 2022, and then we are looking at advocating for people, parents, guardians, to stop interfering with especially the girls' hymen. So what are your last words to this parents, to this guardian, and why we need to keep pushing for this advocacy?
Okay, we need to really push well. Well, to the parents, I'll say it's normal for parents to be concerned about all of this. But like some people say, what will happen, no matter what. It's not a license to say, okay, allow the children to be wayward and all that. But let's put more effort into bringing the children up, making them confide in us to be able to, because I'm a parent, I have a 7-month-old, you know, and of course I have a daughter, so there are things you think about also, you know, concerns that you have. But let's put a lot of effort into bringing them up from the very early stage. You know, just I can borrow a word of scripture that says, bring up the child in the way he should go, and when he grows, will not depart from it. So I think that, you know, scripture comes to play here. So from the very early stage, bring them up in the way they should go. Let them confide in you as parents. We will tell you things that are going on, and parents have to be very observant when you see attitudes of children and all that in those cases. But it doesn't mean that we become policemen around the children and not, you know, we instill fear in them. You're going to check their genitals if this happens and all that, and they're scared and so they are virtually panicking. That should not be the way.
Okay, so then what exactly is the right way? Probably, like I got on social media, someone says she saw her daughter walking in a particular way and then she just knew that something was wrong. So that's why she had to start checking. So if she didn't have to do all those egg and or line check, what other ways could they check for?
Well, in cases whereby they are really concerned, because some of all those absurd things that they do could even create more problem than the problem that they are even trying to find, you know, is get professional help. So talk to your doctor, a pediatrician, because they are children, or in some cases where you have infant and juvenile specialists that, you know, gynecologists that also attend to children and all that. You know, you could talk to them and they'll guide you in examining the external female genitalia without having to use all these crude methods of wanting to know. Of them, just by clear physical examination, looking at the whole area and all that, they'll tell you if there's been anything, you know, if the area has been tampered with and all that.
All right, so before we round up, I'd like to ask you a very personal question. Now, you have a daughter
and
you're a gynecologist. Would you accept to check on her, or you just allow her to go get maybe your colleague to check on her?
Okay, well, in medical practice, generally, it's because sometimes you get emotional and all that. It's better that you have colleagues, you know, that, of course, I mean, the kind of environment where I work, I have very qualified colleagues that would, you know, attend to her. Like, I remember when my wife had to deliver and all that, even though I was around and I was on call that day, all those who were around were my junior colleagues. So it's split into the next day. Then, of course, the head of the department and another female colleague came and did, you know, the procedure that led to the birth of my child. So I was just observing, because you get emotional sometimes in decisions and all that. So it's better.
All right, then. Thank you so much for your time with us, Dr. Onuche. Audu, it's always a pleasure having this talk with you.
My pleasure.
All right, we have been chatting with Dr. Audu Onuche. He is a consultant obstetrician and a gynecologist, and it's been a wonderful time. I'm sure you must have been entertained, informed, and rightly educated. All right, we'll get another guest and we will expand this topic a little bit more. It is still International Day of Women 2022, and we're celebrating every woman across the world. I'll see you shortly.
It's not just the child expressing their inconvenience. It's about the parents listening and be ready to take action. Because when a child comes to you as a parent and complains, okay, mommy, this is what happens when this person does this. This is what happens when this person does this. And you ignore him or her, or you don't take action, that child might never talk to you about that issue again. So the parents have to listen to their children. If a child comes to you and tells you this thing is disturbing you, you should even applaud that child. You should applaud that child, because that child is speaking up. That child is telling you this is what is disturbing you. So as a parent, you should listen, you should take action, and make sure that child is comfortable with the new action you're taking. You can't say, okay, because you don't want to hurt grandma's feelings, then your child should suffer. That is wrong.
Glad to have you back. If you just joined us, this is The Conversation. We are reaching you from Kaftan's television studio here in the nation's capital, Abuja. Now we have Henrietta Odey. She is a child protection advocate and also she is a body safety expert. She'll be talking to us on child education and sex education. Hello, ma'am. You're welcome. You're welcome to the show.
Thank you for having me.
All right, great to have you. Now let's talk about checking your daughter's hymen regularly during bath time or any wash time. Is this is it okay? Is it healthy?
It's not. It's actually in its own way sexual or a kind of abuse, because your daughter is a human being and she has rights to her body parts. You can't be checking her every day or every time whenever you remember, because you feel okay, there are perverts outside and they might hurt her. That is not the best way to protect her. So you're scaring her. Not only are you scaring her, you are abusing her. And she may grow up and think that is normal. That is what is the usual. That is the right thing to do to children, and do it to our own child or other children as well. So it's really wrong. There are other ways to protect your daughters or your children. You can't be checking hymen every time. It's actually an abuse on its own.
Okay, so you know that back in the days, some parents use their full finger or they use egg, either boiled or raw egg, and then they put it into their daughter's vagina just to be sure that she's still a virgin or that she has not been touched. Do you still have such parents in this 21st century?
Yes, they do. Because there was a time I had one celebrity abroad who did that with his teenage daughter. A Black American, not even African, Black American. He did that. He took his daughter to the hospital to get tested, to get checked, to check if her hymen was still intact. So there are still some parents who do this.
Okay, tell us, how has it been for you, being a child advocate, being a child protection advocate? What kind of things have you seen during your years of practice?
Okay, let me tell you a short story. There was this woman who complained that her son penis doesn't erect. As in, when she's beating him, it doesn't erect, and she was worried, so she started touching his penis every morning or every bath time. She starts touching his penis that she wants it to get erect. So we had to caution her, and we told her she was actually abusing her son, that she had no right to rub his penis or touch it in that way. And she was scared. She wanted to know if it's working and all of that. And I was like, if you were scared, you should have gone to the hospital. You don't, it's wrong to keep rubbing his penis just to make sure it gets erect or to check if it's working. That's improper. That's wrong. That's inappropriate. So we corrected her. She got to know that she was abusing her son by rubbing his penis every bath time. So there are very, very strange stories I've heard. Many parents do a lot of things in the name of protection or caring for their children, but they're actually harming their children.
Okay, so at what age does parents do this hymen check on their daughters or their son to check if they are still erect or if they've not been touched?
First off, there should be no checking at all. No parent should check their daughter's hymen. It is wrong. There shouldn't be any checking. So there is no age to say you start checking hymen. It shouldn't be checked. It shouldn't be checked. If the parents follow proper measures to protect their child, they wouldn't even need to do that, because the child will be protected. If there is any harm or the child was involved in a near situation of harm or injury, that child will tell the parent if the parent has been doing what he or she is supposed to do. So there is no age There is no age to start this thing. It's born to even do it. But parents start at any age. They start at any age.
Okay, so what is or how much does this affect the child psychologically, or even cause any kind of harm or damage? What kind of effect does it cause to children psychologically?
Okay, first off, because these parents just do it, they don't even tell the child what they're doing. The child doesn't even know what the parent is doing. So she might feel, or he might feel, okay, there's something wrong with me. Maybe my parts are not working properly, or there's something, maybe I have an abnormality or something. And they grow up with that thought. They feel, oh, there's something wrong with me. They feel they are incomplete, and it affects them for a very, very long time. So it affects them emotionally because they're like, I have a problem. There's something wrong with me. I'm not complete. My parents have been doing this to me. That means this is not, I am not complete. I'm not a complete person.
Okay, so if perhaps the child or the girl child explains to their parents what it does to her or what this check does to him, does it change anything at all?
Well, if depending on the relationship of the child with the parents, if the child tells the parents, okay, I don't like this thing you're doing, this is what it's doing to me, it's applaudable because the child is even the child is vocal enough. The child is not afraid of the parents and is even telling the parents, this thing you're doing to me, I don't like it. This is what it's doing to me. It means that child is finding her voice or finding his voice, which is commendable. So, but those kind of parents, will they listen, even if their children tell them that? Will they listen? Those kind of parents might insist on doing it because they feel that is the best way to protect. They don't try to seek other ways to protect their children that will be okay for both the child and the parent. They just do what they feel that archaic way of doing things. That's the way they just follow through. They don't listen to the child. They don't care about the feelings of the child. They just go ahead and do that thing they feel is the right thing to do.
Okay, so let's talk about child's rights and the child's rights. Is this actually a violation of their rights? And we know that we have the Child Right Act. Does the Child Right Act also cover all of this?
Yes, it does, because this is a violation of their rights. Every child has the right to decide what happens to their body. But the only problem is most children don't know they have the right to decide what happens to their body. So their parents do anything. They do anything to them. That's why with my body safety education classes, I've been touring in school, and I've been teaching these children that they have every right to decide what happens to them. They have the right to speak up. Even if a parent is maltreating or hurting or touching them inappropriately, they have every right to speak up. I shared with them numbers they could call if they are in that situation. So every child needs to know, needs to be empowered, they need to know they have the power to choose whatever happens to their body. So that should be it should be taught in schools, it should be taught in homes, in churches, in mosques, in communities. Every child should know they have the right to decide what happens to their body.
Now, taking a cue from what you just said, every community, every child should know what the right they have to their own bodies. Now, as an advocate, I'm sure that you're supposed to, who exactly are you even supposed to complain to? Because now when you talk to some parents, they'll tell you that I gave birth to my own child. You don't have any right to lecture me on how to take care of my own child. So I'm sure you must have been getting all those kind of reports during your years of advocacy. What do you do at that point?
The truth is, as well, we have social welfare, we have sexual assault referral centers, and if the child is being abused by his or her parents, we have every right to report that case to Sexual Assault Referral Center, and they will take it up. Sexual Assault Referral Centers are set up by the government, so it's more like everything is organized. You take up that case and make sure that child is safe, or that child feels safe wherever he or she is. So, but with the awareness we're bringing to communities, to schools, parents are beginning to understand this is wrong. That is not the right way to do things. So they are actually welcoming teaching or the enlightenment.
Okay, so in these cases, how do you advise such parents, and what do you tell them? What is exactly the right thing for them to do?
Okay, first I tell them, equip your children, arm your children. The best way to protect your child from being sexually abused is to arm them with the knowledge and skills. But if a child is ignorant and something happens, that child doesn't know what to do, or something is about to happen, that child doesn't know what to do. But when you have taught that child and you tell the child, okay, these are the signs. When you see such signs, be careful about this kind of people. Do not go into people's houses alone. Do not collect gifts from people. These are your body parts. You should know them. You should call them by their right name. Nobody should touch you in this unsafe region. If anybody attempts to touch you in this region, these are what you should do. So if you teach your children that, you are empowering them. When such a thing happens, they will not ask, Daddy and Mommy taught me this, or this man or this woman is not supposed to touch me here, or even try to touch me here. And this is what Daddy and Mommy said I should do. If this person tries to touch me here, even if the person tries to threaten them, their parents have already taught them that, they cannot do anything. They're just doing that to scare them. So the children will not be scared. They will still report to their parents. They will still shout. They will say no. They will run from that place of harm. You get, but not telling your child anything, they don't know anything, and they see that kind of problem or danger, they're likely to fall, or they are likely to be hurt. As I taught primary school, I noticed even children in primary school, they do not know what private parts are. Ask them what private parts are, they will call their type. They will call different parts of their body, but not a private part. And I'm like, what is the bad thing about this private part? Our parents cannot teach their children the proper names. It's important they teach their children these things. It is not bad. Saying penis, vagina, vulva, buttocks, anus, it is not bad. They are just words. They are the proper names of these parts. It doesn't mean if you call the names of this part, the children will have to have sex tomorrow. No. You're teaching these children. If somebody attempts anything tomorrow, they'll be like, yes, it was this part that this man was trying to touch. And you will now take action. But you tell your child, all this place is called Vivi or Kiki. They will come and tell you this, they will come and tell, okay, this person tried to touch this part. But because you are not being specific as a parent, you will not understand what that child is trying to do. Or if you teach your daughter, okay, this part, this vulva, the inner part is the vagina. Okay, the child will know if somebody tries to touch, either raising her skirt or putting his hand, this man tried to do this and I ran away. I hit him and I ran away. It was this part he was trying to touch, or it was my breast he was trying to touch. All these things are not bad. So parents need to teach their children these things. You can imagine a boy in primary 3 was asking me what anus was. He was asking me what anus was. Meanwhile, this guy, I'm sure they bathe him, they wash his anus, and he pools daily. But he did not know what anus was. The simplest of things he did not know. So parents need to teach their children. It is not bad. It is not bad. When you teach them, you're equipping them. You're equipping them against sexual abuse. That's what a lot of parents need to understand.
Okay, I'd like to ask this very personal question. With all of the advocacy that we've gotten over time, and then we'll keep talking about rape, talk of work against rape, and then how parents or people will come out to say that they will castrate the rapist, you still get pedophiles around, people who just sleep with children, in fact, infants. And then why do you have any reason why exactly that could come in anybody's mind to do?
The truth is, some of them were sexually abused or abused as children. So that is the only normal, that's the norm they are used to. Being abused, they don't see it as a bad thing. That is because of what happened to them. So they don't even feel they're doing anything bad. They just feel that you're seeing them doing something bad. But they are doing it because most times they were abused as children.
Okay, so I hear you talk about, you said a particular child who doesn't even know what his anus is. And then you still have parents, even up until now, they find it so difficult to call their children's sexuality or reproductive part exactly the name it is. You see, some children will tell you that, no, that's my pee-pee or that's my wee-wee, and that's it. So at what age should parents start teaching their children sex education and calling the name right what it is? Call a spade a spade.
Okay. So appropriate sex education should start as early as possible. And the first stage is actually body part awareness and appreciation. What they teach in body part awareness and appreciation is proper name of all your body parts and including the private parts. Like for me, I started teaching my daughter when she was about 6 months. She couldn't talk, she couldn't speak. But she would, as she learned, when she was about 8, 9 months, as she learned, when I called the names of this part, she would touch them with her little hand. So that was how I taught her. And by age 1, she already knew this part. So children actually absorb knowledge like point. So it's not knowing their body parts or you teaching them their body parts is not hard. You can learn it as early as possible. You bake them at big time. This is your head. These are your eyes, your nose, your lips, your hands. As you're beating them, as you're wearing their clothes, you tell them. So starting from 1 is not too early. It's okay. It's knowing at least by age 1 they should know their body parts. Children can learn these things. So appropriate. I like calling it body safety. So body safety, because it's appropriate for children, young children, it should start very early.
Okay.
When the child knows the proper name of his body part, then you can go to the next stage.
Okay, so now if you have to do all of this, if you have to make your children comfortable to talk to you, tell you things, what happened to them in school around before school time and all, if they were touched by someone they know or do not know, it means you have to be very friendly with your children, create a very friendly atmosphere with your children so as to encourage them to talk when they need to talk. Now, how can a parent, career parent, business parent, or the I am too busy kind of parent, make their children their safe haven so as they can be able to talk to them? Because you remember the old generations, if you tell your mom or your dad, especially your mom, that you're having a crush on a guy, they would give you the word of your life. In fact, the beating and the judging of your life. So, and then a lot of us actually grew up to know that if a guy touches you on the arm, you could get pregnant or grab an infection. So how can parents make their children their safe place so that they can be able to confide on them and not to scold or judge them?
The truth is, every couple or every man or woman intending to have children should prepare. It's not about having sex or making love. They should be prepared mentally, emotionally, and otherwise. Okay, I'm about to have a child, or I want to have a child. Am I ready to do the work involved? A lot of parents are not ready. A lot of parents were not ready. They just got pregnant and yes, you install nannies, they take them to school, blah, 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 blah. So parents need to sit down and ask themselves, am I sure I'm ready to do this? Am I sure I'm ready to parent?
Okay, sorry to cut you in on that. Are you saying that our parents, our mothers then, they didn't sit down, or they were not ready to become parents? Because that's what used to happen in their generation.
should I say their generation, they were raised differently. And so most of the things they did or they saw, most of the things they did to us, that was what their parents did to them. So I can't say emotionally they were not ready, but I could say they were not raised the way they should have been raised, because they learned this harmful attributes they have now passed down to their children. So, but with some children I have seen, I noticed their parents were not emotionally ready. They were not fit. They just felt, okay, I'm married now. Let us give birth to children, because they do not have time for these children. They do not create time for these children. These children are taken care of in school. Imagine a child comes to school and the child is in school from 8 to 5. Even the 5 o'clock is the nanny that comes to pick the child. The parent, he sees the parent maybe 8, 9 every day. They do not make, even weekends, they do not see their children. So some parents don't just care. Our parents, at least they had our time. Yes, maybe they flogged us and they did all sorts, but they were there. They were there. But these parents are not even there. They are not there at all.
So at this point, how can those kind of parents, those very busy parents, how can they create an environment where their children can become their friends, to tell them just anything?
Okay, first off, you have to let your child be expressive. You can't have an expressive child when you continually beat your child or continually shout on your child. What you're doing is killing the morale of that child. When you continue beating and shouting and doing all sorts, threatening, you're killing the morale of that child. That child will not be expressive. But when you train your child or you're raising your child to be expressive, you encourage your child to speak out. Anything your child is not pleased with, the child will talk. Anything, whether positive or negative, the child will speak. Do you understand? Because you've created that atmosphere. You sit down, you talk to your child, you play with your child, you listen to your child. You get that child knows you love him or you love her because you create time to be there, and whenever you're there, you're there 100%. So to that child, you're his friend, you're her friend. And when you're a child's friend, when you're your child's friend, they will talk to you. At that age, they will talk to you. So it's not just creating time. Your time with them has to be complete. You have to be there with them emotionally. You have to listen to them. You have to hear them. You have to play with them, talk with them. You have to unlearn harmful habits you got from your parents, like flogging, threatening, etc. So there's a lot to be an intentional parent in our days. There's a lot you have to do. You have to be committed. Well,
okay.
One thing about kids is when they are expressive, when in homes that they are allowed to be expressive, they can be their full self. They can be who they are meant to be. Then you see their real characters.
Okay, so now let's talk about grandmas coming home to see their grandchildren, or going for omugo, like the Igbos call it. And then I actually talked to a particular child, and then she complained that anytime that grandma beats her, she always feels this pain in her vulva. And then some other people would complain that grandma washes them with very hot water, like it is some kind of dirty rag. And you just begin to wonder, does that even make it clean? And when she complains to grandma, grandma says, don't worry, it will go. When she complains to her mom says, grandma is a pro. She has been baiting children for years, decades. So don't worry, just relax, the pain will go. So for a child who is watching us right now, or for a parent who is watching us right now, how can they conveniently express their inconvenience?
Okay, the truth is, it's not just the child expressing their inconvenience. It's about the parents listening, and be ready to take action. Because when a child comes to you as a parent and he complains, okay, mommy, this is what happens when this person does this. This is what happens when this person does this. And you ignore him or her, or you don't take action. That child might never talk to you about that issue again. So the parents have to listen to their children. If a child comes to you and tells you this thing is disturbing me, you should even applaud that child. You should applaud that child because that child is speaking up. That child is telling you this is what is disturbing me. So as a parent, you should listen, you should take action and make sure that child is comfortable with the new action you've taken. You can't say, okay, because you don't want to hurt grandma's feelings, then your child should suffer. That is wrong. There should be a way you explain to grandma and grandma will understand. Okay, let us dilute the water so it's warm whenever you're washing that part. Or better still, let us teach her how to wash it so that she washes it the way she's. We will watch her while washing it to make sure that she's washing it well. You get?
Okay.
But not that the child comes to you and complains and you don't do anything about it. You just continue in that. You're teaching the child that she should endure harmful things, or when things hurt her, she should not do anything about it, and that is wrong. Because somebody might be sexually abusing her, and because she has learned from you to endure, she might be enduring it instead of speaking out. So whenever your child speaks out, take action. It's important you take action. It's important your child sees my mommy and my daddy fight for me anytime I complain about something disturbing me. They will be confident enough to come and tell you about something serious, even more serious next time. So it's important we take action when our children complain about certain things.
Thank you so much for your time with us, Henrietta Odey. She is a child protection advocate and a body safety expert. It's been a wonderful time having this conversation with you.
I really enjoyed it. Thank you. Thank you for having me.
All right then. All right, I'm sure you must have learned a lot on today's episode of The Conversation. I will definitely see you again next time. From the nation's capital, Abuja, I am Annabelle Oji. God bless Nigeria.